This is Emily's story. Emily had a conversation with Nicola Smith of the Torbay Public Health Team in November 2016. Nicola and Emily met up at the living room run out of St Mary Magdalene's Church, a drop-in on a Wednesday and a Friday lunchtime which Emily uses regularly. Many of the people who drop in here are from marginalised groups, and some have substance misuse, housing, alcohol, mental health and other difficulties. Emily says she's been in substance misuse services in Torbay now on and off for 5 years. Her partner is currently in jail, and Emily talks about the recovery support she receives from people at the living room. Emily and Nicola are not their real names, but they are real people. Their real names have been changed to protect their identities, and their conversation is read by actors.
It's good here. They are amazing people. They're there for you. Everyone has helped, supported me and my partner. People here know my partner as well, and his struggles, and unlike a few other places I know, they want to work with me and my partner. It's about both of us. We live together, so we've got to know how to deal with life together. You get none of that support from anywhere else. Here at the living room, they're there for you. They don't judge you, they help you where they can. And yeah, it's very supportive. I can talk to them.
Nicola asked Emily how she ended up in Torquay.
It was to get away from the drugs where I lived, but it didn't quite work out that way. I was born abroad and my background's very checkered. I don't have any family in this country at all. I don't talk about them. They're dead to me. People here are my family, and it's taken a few years for me to trust them. I still say every now and again, how can you say you love me? And you don't even know me. And that's true. But they stand by me and they support me. And that's what brings me back here. All the time. Sometimes all messed up.
Emily's children have both been adopted, partly because of her long-standing substance misuse problems. Emily has had a difficult family background, and her progress through recovery from substance misuse may seem slow to some. She acknowledges that her drug use is partly to cover up hurts from her childhood and her life, and she confided in Nicola that every day is a struggle with mental illness, depression, self-harm and eating difficulties.
One thing they told me here is you have to be strong. But being a drug user, I think you're actually really weak, because you're not strong enough to face any of the hurts you've been through and feel the pain. So you use drugs to cover that up. And some people don't understand that. It's like, hang on, everyone has strife in their life, but it depends on how much support they get. If you've never had support, you don't know who to turn to.
Some people live with the memory of difficulties from their childhood, and some of those people learn to medicate the pain it causes with substances. There are a range of community, voluntary and faith sector providers in Torbay who can help people in recovery to regain a sense of identity away from the world of drugs, alcohol and criminality. If you are thinking of seeking help for substance misuse, please talk to your GP, who will be able to make you a referral into substance misuse services, or you could contact them direct. Their details are on the homepage.